Welcome to AskDrManny.com. Thank you for clicking on and making us your friend in Facebook and sending all the questions that you do. Got a question today on a topic that is very sometimes embarrassing to ask, especially when we're in the office, and that is intercourse during pregnancy. Look, the intimacy of intercourse, it's very important to maintain in a relationship, and of course during pregnancy. That question comes up all the time. A lot of women feel very nervous about it. A lot of times husbands feel very nervous about it. But the bottom line is that yes, you can have intercourse during pregnancy. Now, there are certain high-risk conditions where intercourse is not advisable. So let's go through them one at a time. If you have a history of a lot of bleeding in the first trimester, where the doctors are worried that there's a detachment of the placenta, you'll hear those words sometimes when you get an ultrasound at the very beginning. It is not a good idea to have intercourse until it's cleared and there's no more active bleeding in the first trimester. You want to maintain that, more rest, more pelvic rest, and that's important to consider. The second condition where intercourse may be a problem is in women that have a history of an incompetent cervix. These are women that have lost a pregnancy in the second trimester. Many of them may have now a stitch placed in the cervix. So the question is, we want to minimize infection and any trauma to the cervix. So again, if you have a history of an incompetent cervix, that might not be a good idea to have intercourse. The third condition, which is an absolute contraindication to intercourse, is when women have a placenta previa. And we talked about placenta previas in other articles, but basically this is a placenta that is implanted in the lower segment by the cervix, and the risk there always is, throughout the pregnancy, is that you may have significant bleeding, which may lead to an emergency delivery. So again, pelvic rest is very important, and intercourse is totally contraindicated in patients with placenta previa. But if you don't have any of these conditions, talk to your doctor about risk factors, of course. But sex, I think, is perfectly fine to do during the course of your pregnancy. So keep sending the questions to AskDrManny.com.